We know these positions can often be thankless, but the work you do to help and provide support to our community in various ways is incredibly valued. We especially want to send a shout out to our team members working our public information line and the folks at 211-311 for helping to answer questions and provide guidance to members of our community during this pandemic. Thank you for your service. Our real life example of putting the 5 core actions into play is hosting a spooky movie night. We know you may be searching for alternate activities to do for Halloween and to reduce your risk of getting COVID-19 while doing those. Hosting a spooky movie night is a great way to enjoy the holiday season while also staying safe. You can host a watch party with just your household, or even invite a small group over. Just make sure that you can spread out at least 6 feet apart between households. Everyone can pick their favorite character in the movie and dress up as them. Or you could even turn it into a virtual watch party with friends and family who live out of town or even in town. Everyone can start the movie at the same time and chat about what's happening over FaceTime or Zoom or some other platform like that. That's just one idea to enjoy the holiday season while staying safe and healthy. Moving on, we are hosting another public flu vaccination clinic today in Lonsdale at the Haslam Sansom Ministry Complex from 3 p.m. to 6 p.m. We encourage everyone who needs a flu vaccine still to come and get theirs to get taken care of for the season. We will have flu mist and flu shots. However, we will not have the high dose flu vaccine available at that clinic. All of our public flu clinics won't be taking appointments, and COVID-19 safety precautions will be taken. And now we'll move into the local situation. We have 83 new confirmed cases since yesterday's report, giving us 10,555 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 467 probable cases. 9,990 of our cases are considered inactive, giving us 947 active cases. 388 individuals have been hospitalized at some point in their illness, and 51 Knox County residents are currently hospitalized. Fortunately, we have no additional deaths to report today, keeping our total at 85. And now we'll transition to the benchmarks for the day or for the week. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks, that's what a rolling average is. Overall, what we mean by this is, we are trying to see if things are getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? As a reminder, all of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case.count or -count. I'm sorry about that. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and growth rate over time. During the last 2 days of this time frame, we saw 2 yellow flags noted. One more yellow flag, and we would have classified this benchmark as yellow instead of green. We have received an average of 84 cases over the past 7 days and an average of 81 cases over the past 14 days, showing a small trend upward. We are continuing to represent this benchmark as green, but we're keeping a very close eye on this data. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we utilize 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, 3 red flags were noted for lab turnaround time, but not on consecutive days. And over the past week, lab turnaround time has trended up slightly to 2.5 days. Regarding testing, we did have flags noted on weekends when testing is not as widely available in the community. And over the last 2 weeks, testing has decreased in our community. This is a trend that we've been seeing since the beginning of August, and we've talked about a lot. Because of these factors, we are continuing to represent this benchmark as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to investigate new cases within 24 hours and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in the desired timeframe. And because of this, our benchmark continues to be represented as green. I do want to take a minute to say that in order for this process to work, though, we need individuals and businesses to cooperate with our investigations. We continue to encourage everyone who receives a call from us to work with our team to provide the necessary information to help keep our community safe. It's very important that we have that cooperation as we navigate this. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as COVID positive patients and patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During the past 14 days, we have noted 12 consecutive red flags for patients hospitalized with COVID. Additionally, we saw 3 red flags and 1 yellow flag noted for ICU patients in the past 14 days, as well as 3 red flags for ventilator use. The last 2 days were consecutive. Most notably, despite the relatively low number of cases that we've been seeing, this week we have the highest number of COVID-19 hospitalizations since the pandemic began. These flags that we just talked about, though, are based on published metrics that illustrate statistically significant shifts in the data. And I think you can see it very well on the bar or the line graph that we have with the steep trend up and it being higher than what we had before. After speaking with our hospital partners, they have recommended that the benchmark remain yellow because they are currently below surge capacity and have adequate staffing capabilities for the current number of inpatients. However, they would like us to stress, and we definitely agree, that our community members should pay close attention to this metric and take it very seriously. These data are trending in the wrong direction for our community. As I mentioned last week, and as our hospital partners have described many times before, hospitalizations are a surrogate for how well our community is doing, as it does not rely on testing choice or access. Whether or not an individual has been tested previously does not keep them from the need to be hospitalized if their illness becomes severe. So in seeing the rate of hospitalizations continue to rise, the hospital systems are asking that the community intensify their efforts to slow the rate of COVID spread and result in hospitalizations. Please continue to follow the 5 core actions daily. Also, please note that again, we strongly encourage those who are at high risk for exposure to this disease to continue to get tested. Avoiding a diagnosis does not help the individual or community, and if anything, it allows for the disease to continue to spread throughout the community, which has many consequences. We need to keep our hospitalizations as low as possible so that they can continue to provide the highest level of COVID and non-COVID related care to all members of our community without having to limit services again. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan the response together to best serve the community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. And our 5th benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows reported deaths of Knox County resident by date of death. Over the past 2 weeks, we have seen 13 deaths with 8 deaths in the last 7 days. The information available continues to lead us to represent this benchmark as yellow. And under our supplemental data section, we have 2 charts. The first chart shows new daily COVID cases per 100,000 population. On this graph, we also show the 7-day and 14-day trend line. As of yesterday, our 7-day and 14-day trend line showed 17 cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and our positivity rate is starting to trend back up, and the 7-day average is 8.4%. Both of these charts will be published Wednesdays with our benchmarks weekly. And I'll now open it up for questions.
right. The first question we have is from Jeff with WATE. The city is clearing out a camp for folks experiencing homelessness on Blackstock Avenue. We've heard some concerns about the lack of social distancing and others in that camp. Has KCHD had contact with people living there, and is KCHD part of the outreach effort?
We're aware of what the city is doing. They let us know of their plans in advance, and we appreciate that. And we have a team that works directly with individuals who are experiencing homelessness or at risk of that, and can help them meet their needs if they are either a COVID case or contact to a case and need various methods of support. And so in those instances, I can't say for certain that we've reached out to those individuals, but if they're in that process and would have those needs, they would be referred to our social services team for additional help.
Also from Jeff with WATE, do you have any statistics when it comes to the number of COVID-19 cases among people experiencing homelessness in Knox County?
I don't have that data right in front of me. So far, though, the trend has been very low, I can say that. And we have several partners that we work with, Volunteer Ministry Center specifically, who has the guest house available to help folks that test positive or contacts to cases to have shelter during their either isolation or quarantine period.
From Grace with WBIR, we've seen our highest hospitalizations in Knox this week since the pandemic hit. Does this mean you'll be expecting deaths to kick back up in the coming weeks?
I don't know. The trend typically goes that way, but I will say while the hospital trend is not going in the right direction, and we are very concerned about it, on the plus side, we are not seeing the ICU and ventilator usage go up at the same rate as the hospitalizations. And so hopefully that's a good sign that our deaths will not spike, but we'll have to just wait and see what happens.
From Claire with WUOT, why do you think we are seeing so many hospitalizations now? Does this make you think there are significantly more active cases than case numbers suggest?
Honestly, that's what we're concerned about. We're worried that the burden of disease in the community is higher than what our rates are showing, and that this is a reflection of that. And that's why we really want to stress to everybody that if you're at high risk of exposure, if you're in congregate group settings, if you've been exposed to cases, all of those folks, we definitely want you to continue to get tested. Please don't avoid getting tested, especially if you're symptomatic, so that we can follow up with you, make sure that you have proper guidance and information to help prevent the spread of disease, and that we can also reach out to contacts. That's the only way the system works, and we need to continue to move down the path doing that.
From Jeff with WATE, how many people have been vaccinated for the flu so far in KCHD clinic events, and how does that compare to in-school events?
I do not have that information in front of me. We'll have to get back to you on the number that we vaccinated so far, and we'll have to get back to you on the comparison with that data. I do know we've been pleased with the turnout that we've had so far, though, in the clinics that we've had.
His follow-up question was, what do you anticipate when it comes to vaccination numbers this year in the absence of those in-school clinics?
We really hope that the way that we've set these up have been beneficial for families, that the whole family can get tested, vaccinated, and will continue to do so, and that we do see high vaccination rates. It's very important this year. We can also tie back to what we talked about with hospitalizations. We want to keep hospitalizations low, and that can also mean keeping the flu burden of disease low. And so that's very important. I have heard that the first couple of clinics that we had seemed to work out really good with timing, with the early timing being the kids getting out of school and parents stopping by. And then we started seeing folks coming in when they were getting off of work at the later hours of the clinic. And so hopefully it's working well for the community, and we encourage them to utilize those clinics or any of the numerous other options to get flu vaccine in the community, because it's not just us.
From Grace with WBIR, you mentioned testing has trended down since August. Is KCHD doing anything to increase testing in the community?
We are continuing to offer testing here every day, and then we have had some community events working with folks that have less access, and there's some of those happening this weekend, and they've happened recently as well. So we're continuing to do the outreach that we're doing. Where we've mostly seen the trend going down or at other areas outside of our testing events, specifically university testing and all of those things associated with that. We've definitely seen a downward trend.
To follow up, Grace asked, are there any particular age groups avoiding testing more so than others?
We don't, we get testing numbers, but it's not, we don't have it separated out in our data by age groups, but we do know, just talking to our partners that typically serve those populations, specifically that high school and university age groups, that there has been a decline in testing. That's what we've heard from the folks that are out there hands-on doing it.
From Vincent with the Sentinel, our death total for COVID-19 is 85. At this point, we're more than double the number of fatalities from traffic accidents this year and far over the average for traffic accidents for the past 5. In terms of comparing injury to illness, COVID really blows traffic out of the water. What do you think this means in terms of the severity of the pandemic?
Hadn't thought about it that way. We talked a little bit about where it falls in cause of death in the nation and the community. It's, I believe, 3rd leading cause of death in the whole nation. And that says a lot. And what's more, or even adds concern to that is, traffic accidents aren't a communicable disease. So, and so when you have a communicable disease that is causing this type of, and this level of death that can continue to grow exponentially, that's concerning. And that's why, again, all of the efforts that we have is to keep those numbers as low as possible, keep the hospitalizations down, so there's not the death from COVID, and also from having secondary effects if the hospitals have increased burden and can't provide the level of care that they traditionally provide.
From Claire with WUOT, do our locally hospitalized patients have access to the same drugs as President Trump has received? She's referencing dexamethasone, remdesivir, and the like.
I think that that's a great question for the hospitals. They do have access, I know, to remdesivir and other medications, but the specifics, I would direct that to the hospitals for their specific ability to access those medications.
From Vincent with the Sentinel, without comprehensive testing, is it possible to control a pandemic?
It's really challenging, which is why we talk about that a lot. And we've been talking about that. We really need people to get tested so we can have quick, rapid response, turnaround for contact tracing. All of those things fit together. They're all linked, and they're very important to be able to control the spread of disease. I know there's, fatigue out there with all of the things that we've been saying to do and the 5 core actions, and people just want it to be over, and they might hear that our case numbers are trending down, but we are still seeing real consequences to this disease in our community, and want to encourage everybody to please stay the course, even if you're tired. We're tired too, but stay the course so that we can try to do our best to control the spread so we don't continue to see negative consequences.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for your time, and we will see you again for our briefing on Tuesday at 12:30. Have a good one.